Okay, good morning, good afternoon, good evening po sa lahat. Sa anong pong panig kayo ng mundo naroon. Welcome to our 219th episode of the Health Updates webinar series. Thank you for being part of our credible online community at sa lahat po ng very first time lang po na makakapanood ng ating webinar episode. Sana po marami po kayong matutunan sa ating topic for this week. And I'm talking about like attachment theory po, no? And we are talking about like mental health issues, especially among adolescents and young adults. So the tapestry po of adolescent, young adult mental health, very intricately woven with the threads of early life experiences. One such crucial thread is attachment style. So ito po ay isang psychological construct that profoundly influences how individuals relate to themselves and to others. So ito po ay may kinalaman po sa mga relationships po natin. So for this week's episode, we'll be discussing the intricate relationship between attachment styles and mental health outcomes in this critical developmental period. Our STEAM panel of expert speakers po will unravel the complexities of attachment theory, exploring po the 4 primary attachment styles: secure, anxious, preoccupied, dismissive, avoidant, and fearful avoidant. Also, we hope to be able to learn how these different attachment styles develop and how they manifest in adolescence and also in young adulthood. We'll also look into ano po ba yung impact of these attachment styles on various mental health conditions, including anxiety, depression, substance abuse, and difficulties in their relationship. And then finally, we hope to be able to segue ano po ba yung mga practical strategies for fostering healthy attachment relationships and promoting mental well-being in adolescents and young adults. These strategies po may very well include therapeutic interventions, communication techniques, ano po ba yung mga supportive parenting practices na lalo na po makakatulong po sa ating mga magulang. This is the Health Updates program and I'm your host, Dr. Rian Francis Sarmiento. Always a pleasure to be with all of you during our regular Friday. And also my pleasure and honor to host this program together with one of our program constants, Dr. Stella Mariose. Ma'am Stella.
Good afternoon, Doc Raymond. Good afternoon to all our viewers. But first of all, I would like to congratulate Dr. Gerardo Legaspi for his appointment as the in his fourth term as the PGH Medical Director. Congratulations, Sir Gap. Welcome to our participants here in the live broadcast of the Zoom webinar and to all those watching via live streaming at the TVUP YouTube channel, as well as the UP System Facebook page, TVUP Facebook page, and TVUP Signal TV channel 101. We have very interesting panelists for today. First, we have Dr. Constantine David Delia, who is an associate professor at the UP College of Medicine, and I will introduce him further later on. And also with him is Dr. Michael Shonson, who is the head of the psychiatry. He's a head of the psychiatry liaison officer and residency training program and in the Department of Psychiatry and Behavioral Medicine. Our new program is now called Health Updates. We have done a little bit of reformatting for our program, but we are still maintaining the same high quality and then leveling up to take a closer look at the existing and emerging health problems in the Philippines and in the rest of the world. For 2024, we want to get immediately to the problem of the discussion, the heart of the discussion. And so our program is now 1 hour shorter. Before we go on, I'll take you back to Raymond for the person on the street video.
Thank you so much, Ma'am Stella. So for those who are asking, this is something that we have prepared, but really just to get us started, get the ball rolling, determine ano po yung baseline knowledge of our interviewees on this particular topic before we delve into and discuss ano po ba, how do we better equip ourselves, recognizing the signs of distress, how do we provide compassionate support, how do we guide individuals toward the path of healing and resilience. Ito po, very, very short video coupled up by the webinar team and our questions to our interviewees. Ano sa palagay ninyo? Ang impluwensya ng pamilya, society at komunidad sa mental health ng mga teenagers at young adults. Ano naman ang impluwensya ng mass media? Sa tingin po ninyo, gaano kalalim ang epekto ng kanilang impluwensya? Paano ba masasabing may mental health problems ang isang tao at ano-ano ang mga pamamaraan upang mabigyang lunas ang kanilang mga mental health issues or problems? Please watch this.
I think there's a significant impact of families, societies, communities on the mental health of young adults.
I think they play a pivotal role when it comes to mental health issues. I think one of the major factors that affect mental health of young adults and teenagers.
Well, I think mental health is multifactorial. So everything from family to different exposures to your environment really influences like your affect, your behavior, and how like you deal with everything that comes your way.
So your family is basically the first community you interact with as a person. So definitely there will be a big effect on your mental health. It can shape how you look at things, how you think about things, and your outlook about things.
Oh, I think that's a big factor too. Because let's say stuff like Instagram or TikTok, they're catered to, all of us are trying to be a better version of ourselves. And then when you look at TikTok and Instagram, there are certain things that when you compare yourself to other people about, you just feel worse about yourself.
Well, I think it affects it significantly, and sometimes in other aspects, sometimes negatively. So especially since with social media, people can easily compare themselves to one another.
It depends really on the circumstances surrounding the person. It also depends on the person itself. So not every individual is the same, essentially.
Mass media and social media is basically one of the top sources of information right now. So these can also affect, like I said earlier, how we think about certain stuff. So basically it shapes how we perceive things that can affect our mental health as well.
I think it's different if somebody's always been having mental health problems and somebody that just started having mental health problems. But I guess with somebody that I've known for a long time and then bigla na lang they have mental health problems, there'd be key signs like they don't reach out to me, or they don't talk as much anymore, or they're very unresponsive. I would think those are key indicators. But
It really depends talaga. Parang we can't be quick to say that somebody is one. I can't really say a very straight answer, but yeah, one of the red flags would be that anhedonia or possibly intent of trigger warning, intent of hurting themselves or ending their lives.
You should look at patterns of depressive episodes, prolonged negative emotions, or reactivity about certain stuff, easily triggered by certain circumstances. So
Treatments, like it can be through medicine, so of course consult your doctor for that. And also therapy, but also depends on the openness and willingness of the adolescent.
we can explore when it comes to mental health, such as looking at positive behaviors, positive involving yourself in hobbies, exploring other interests, and then talking to people who matter to you.
I think it's just being sensitive with anyone and everyone. Like try to think twice, thrice, or 4 times about what you say, do, or how you interact with other people, because you never know who has these problems.
Thanks so much to our webinar team. It's not really that quick or that easy po na makakuha po tayo ng mga interviewees. So maraming salamat po for taking the time out and taking that effort to come up with that very insightful video. So before we proceed, all certificates of attendance will be given to those who have watched at least 50% of the webinar duration. We have already sent out all of the certificates of attendance to those who were eligible to receive them from webinars 1 to 218. So if you have any questions, you can email us at our up.edu.ph email address. For our webinar today, we'll be having a standard panel discussion format. And after our speakers have presented, that will be followed by a Q&A session. So without further ado, we'll get our webinar underway. Ma'am Stella will introduce our main speaker for today.
Our main speaker for today is Dr. Constantine David Delia. He is the head of the Division of Consultative and Liaison Psychiatry, Department of Psychiatry and Behavioral Sciences, College of Medicine, Philippine General Hospital, University of the Philippines, Manila. He is an associate professor at the College of Medicine, the chair of the Psychotherapy Section, World Psychiatric Association, council member of the World Federation for Psychotherapy, and the vice chair in the Board of Certification of Specialty Board of the Philippine Psychiatry. He was past president of the Philippine Psychiatric Association. Let us all welcome Dr. Constantine David Delia.
Thank you so much, Dr. Jose and Dr. Sarmiento. Maraming salamat po sa inyong introduction. Magandang umaga sa lahat ng mga manonood, mga participants dito sa ating webinar ngayong hapon. So ito muna ang inyong lunchtime entertainment. Pass muna tayo sa Itbulaga or Showtime. So let me start my lecture and share to you my slide. I hope my slides are seen. If someone can
Yes,
tell
sir.
me.
That's confirmed.
Okay.
Yes,
Go ahead.
Thank you.
yes.
All right. So nabanggit nga ni Dr. Raymond kanina no, how relationships are very important because they have a significant implication to our mental health, and also they can contribute greatly to the development of mental illness. So meron ho tayong tinatawag na mga attachment styles. Nabanggit ni Dr. Raymond kanina yung attachment theory na isang psychological construct or model or framework na ginagamit natin ngayon to understand the patterns of thinking, feeling, and behaving of people. And this model is helpful and practical, also relevant because it informs the way we assess and manage mental health problems or mental disorders. So, iba't iba po yung ating attachment styles. Depende yan sa ating caregiving, yung experiences natin na natanggap with our caregivers, especially in the first 5 to 7 years of life. And Dr. Raymond mentioned several types of attachment styles. And ito yung ating pag-uusapan ngayong hapon. What are these different types of attachment styles, and how do they contribute to mental health or mental illness? So una muna, let's have a short intro to the discussion. So sa palagay ninyo, ano yung attachment style ninyo? No? So are you someone who is somewhat uncomfortable being close to other people? Do you find it difficult to trust others completely? Do you find it difficult to allow yourself to depend on others? Or do you feel nervous when anyone gets too close to you? Or do you think that your intimate partners or love partners want you to be more intimate than you feel comfortable being? Or kayo ba ay you find others to be reluctant in getting close to you as much as you would like them to be close to you? Do you often worry that your partner doesn't really love you, or you're worried that your partner won't stay with you or abandon you or reject you? Or do you want to merge completely with another person? And this desire, sometimes it becomes scary to the other person, since they feel like they're being possessed by you. Or are you the type who finds it relatively easy to get close to other people, and you're comfortable being and depending on other people and having them depend on you, and you don't worry a lot about being abandoned or about someone getting too close to you, right? So take note of these questions, and maybe at this point nakikita nyo na yung sarili ninyo ano dito sa mga characteristics na to, and we will this is the basis of our discussion for this afternoon. Okay. Now, yung attachment theory or attachment model or attachment framework ay isang psychological construct no na dinevelop ng isang British psychologist by the name of John Bowlby. So siya yung pasimuno no nitong teoryang ito, or body of knowledge that guides clinicians, mental health workers, or mental health professionals in the assessment and management of mental health problems and mental disorders. So ano bang sinasaad ng attachment theory? First of all, ang attachment theory it's not just a figment of imagination of John Bowlby or psychologists, dahil we have seen in the past decades that there is scientific basis to this theory, and there's empirical data that backs up, the assumptions of this particular model. So this theory states that all of us are born with a particular system that's actually embedded in our nervous system, particularly in the brain. That's called the attachment behavioral system. So this is biologically based. There are neurophysiological underpinnings to this system, and it talks about the bond that is developed between the child and the caregiver. No, so traditionally, ang caregiver would be the mother, but it could be it could be a father, lolo, lola, tita, tito, or a yaya. And this bond exists in order to ensure the safety and survival of the little child. Now, the attachment behavioral system in the brain of that child allows that child to constantly seek proximity to significant others, and these significant others we call the attachment figures. So from now on, I'm going to be using this term a lot, the attachment figures, and that essentially means the significant other that provides the nurturance and caregiving to the child. All right, so again, this theory assumes that we are born with the predisposition to be attached to our caregivers in our earliest years of life. So we come into this world seeking for connection, attachment, or proximity to a significant other. Right? Now, when we are able to establish that connection or bond to a caregiver, it now engenders a sense of safety. So we feel as infants or as children, we feel that we are safe in the arms of reliable caregiver, and this will now allow us to regulate our emotions, whether it be positive or negative emotions. It will allow that sense of safety will provide us with the capacity to be able to regulate feelings of fear, feelings of anger, feelings of sadness, and even feelings of joy or happiness. And when we have established that capacity or that skill to regulate our emotions, then it gives us the handle to be able to manage a variety of experiences in life. So as we move on from infancy to childhood to adolescence and then finally to adulthood. So because we are able to handle a variety of experiences in life, then that will allow us to develop our intellectual capacity and our social skills. So we become more knowledgeable about other people's intentions, thoughts, feelings, and behaviors, and we are able to establish deeper and more meaningful connections with other people. Okay. So through our development in childhood, we need the caregiver. We seek proximity to that caregiver, and we establish that physical closeness. So it begins with physical closeness. Kaya nga importante talaga yung physical connection. So, dito pwedeng pumasok yung usapin about long distance relationships, no? Kasi the attachment theory states that physical closeness is very important because it begins from physical closeness. And from physical closeness, nag-evolve siya into psychological closeness. So the assumption here is we will not be able to attain that psychological closeness to a caregiver or to another person without feeling or having experienced sufficient physical closeness. So with the psychological closeness, hopefully the secure type of attachment is developed. So a secure attachment with the caregiver. Now there are two aspects rather of secure attachment. So meaning ito yung mga basic requirements, no, para maka-develop tayo ng secure attachment to our caregiver. So the first one is safe haven. The second one is secure base. So let's try to very quickly define itong dalawang constructs na to. So the first one is safe haven. So this is defined as the attachment figure who is able to provide a sense of security to the child in times of distress. So looking at this photo, the child is maybe feeling a headache, there's physical discomfort. So what does the mother do? The mother comes to reassure the child and provide comfort and relief. Maybe hug her, kiss her, give her medicine, etc. So the mother here, the caregiver, is the safe haven for that little child, and that little child knows that whenever she's in distress, she has someone that she can turn to relieve that distress. Now, the second aspect of secure attachment is called secure base. So, ang secure base dito also is referable to the caregiver and or the attachment figure. So the attachment figure will allow the infant or the child to explore the world because of its confidence. And this gives the child or the infant the confidence that the attachment figure can be relied upon if needed. So, as children, we run around, at home, in the playground, in the fields, etc. And whenever we to explore our world, our environment, and when we start feeling anxious because we have run away from the mother for a particular amount of distance, and when we look back at the caregiver, we know that the caregiver is there to, encourage us to continue exploring the world. and reassuring us that the caregiver will just be there to support us if, let's say, we fall down or we hurt ourselves in the process of exploring the world. So may and a negative situation can occur. I mean, an insecure attachment can occur when, for example, the attachment figure is so anxious that the attachment figure prevents the child from exploring, or tatakutin niya yung bata. Huwag kang pumunta diyan, may multo diyan. Huwag kang pumunta diyan, huhuliin ka ng pulis. Huwag kang pumunta diyan, masasaktan ka. So, that's not that's the opposite of a secure base. So compare that to a mother who says, go ahead, play around, explore your environment. I will just be here to cheer you on and support you. All right. So, secure base and safe haven are also then they are fancy terms for the words nurturance and protection. So, secure base is equivalent to nurturance, safe haven is equivalent to protection. And again, as I mentioned earlier, these are brain based. There are scientific evidence to the existence of this particular psychological constructs. They are encoded in the brain, and they help us develop our ability to predict and understand our environments, and to develop a sense of psychological security. Okay. So this sense of security will help the kids, the children, develop emotional regulation, as I mentioned earlier. The skill is what they use to handle a variety of experiences. It helps us to develop relatively stable patterns of adaptation to stress, or in Freudian theory, we call this the defense mechanisms. This sense of security also increases our resilience, and ultimately it improves our mental health. So ayon sa mga experts, yung attachment style na develop ng bata at by the age of 1 will most likely predict the way that the child will respond to its internal and external environments in the future. So experts are saying the first year of life, or infancy, seems to be a critical window or period of development. Okay. So moving further, the capacity of the child to effectively regulate emotions and conflicts will allow that child to engage in exploratory behaviors. And as the child explores, so dito ngayon papasok yung concept of broaden and build. So the child broadens its environmental experiences, and the more the child moves from, let's say, the playpen to the sala of the home, to the backyard, and then to the playground, and then to the beach. So there are the child is able to conquer new environments, so that's broadening the experiences. And with each new environment, the child is also able to confront and manage, overcome certain challenges. So the child builds on those experiences, and this broadening and building of experiences will now create new supportive relationships that will further enhance the resilience of the child to stress and provide protection against mental disorders. So experts have shown through research that social support is directly related with secure attachment. So, importante yung support systems, support networks or social networks for us to develop secure attachment. All right. So attachment styles are measured in terms of two independent dimensions. So yung dimension na yon, the dimensions na yon ay anxiety and avoidance. So as you can see here, meron tayong x-axis and y-axis. So yung x-axis natin, yun yung sa anxiety. Yung y-axis, yun yung sa avoidance. So looking at this graph, you can now see the four different types of attachment styles. You have secure, anxious, avoidant, and fearful. Okay, so if we have low anxiety and low avoidance, okay, so ano ba yung ibig sabihin nung anxiety and avoidance muna pala? So let's define anxiety dimension. So this is the extent to which we worry that a relationship partner will not be available for us and that will not be responsive in times of need. Yung avoidance naman, this is the extent to which we distrust a relationship partner. Okay? Whether that's an intimate partner or a brother, sister, office worker, etc. So we distrust the goodwill or the intentions, the good intentions of the other person. And so we strive to maintain behavioral independence, self-reliance, and emotional distance. So so dito sa dimension na to, we distantiate ourselves from other people. So we have this two dimensions within us. We possess them, the anxiety and the avoidance, pero magkakaiba yung degree, right? So kung mababa yung anxiety dimension natin at mababa yung avoidance dimension, most likely we will have a secure attachment style. Pag mababa yung avoidance, mataas ang anxiety, then we have what we call the preoccupied attachment style or the anxious attachment style. Pag mababa ang anxiety dimension natin pero mataas ang avoidant dimension, then the type of attachment that we have would be, or that we will develop, would be the avoidant or dismissive. And then finally, if both dimensions are high, so high in anxiety and high in avoidance, then the type of attachment that's developed is called the fearful type of attachment or disorganized. Okay. So yung moving back, no. So yung anxious, avoidant, and fearful attachments, these are what we call generally the insecure attachment styles. So if we were to categorize attachment styles into two, we have the secure and the insecure. And then under the insecure, you have the three different types: the anxious, avoidant, and fearful. Okay, so if one has an insecure type of attachment, most likely that individual will resort to secondary attachment strategies. So ano ba tong mga secondary attachment strategies na to? All right, so let's start with the attachment figure who disapproves and punishes closeness, and who discourages or disapproves expression of need or vulnerability. So dito hindi tayo pwedeng mag-complain, hindi acceptable yung magsabi na nalulungkot tayo or galit tayo, no? So if that's the kind of attachment figure that we have, then our that type of attachment, I mean, in terms of the dimensions of attachment, we will then try our best to avoid this kind of attachment figure who, does not encourage our expression of our thoughts and feelings. So we develop high avoidant attachment, and this will then lead to what we call as deactivating strategies. So what are these deactivating strategies? They involve not seeking proximity, denying our attachment needs. So sabihin na, no, I don't need anyone. I can live on my own. I can manage on my own. And we avoid closeness, and we avoid interdependence. Now, on the other hand, what if the attachment figure is able to, let us express ourselves, our thoughts and our feelings, allow us to engage in certain actions and behaviors, pero unreliable kasi there are times na pwede kang magsalita, there are times na there are times na hindi ka pwede magsalita. There are times na pwede kang pumunta sa party, there are times na hindi ka pwedeng pumunta sa party. So unpredictable, and you don't know, no, kung kailan pwede at kung kailan hindi pwede. So parang bagyo, ano, hindi mo alam kung ah, darating ba yung bagyo o hindi, or malakas ba siya or hindi. Right. So kapag ganito yung figure and ganito yung description ng attachment figure, then the child will most likely develop a high attachment type of high anxiety, in the attachment relationship, and as a result of that, the child resorts to hyperactivating strategies. And so, ano ba yung mga hyperactivating strategies? So there's an energetic and persistent attempt to achieve proximity, support, and love. But at the same time, the child lacks the confidence that these resources will be provided. Hindi niya alam kung darating ba o ibibigay ba sa kanya o hindi. And so, pag hindi nakuha, resentment and anger can be developed. All right. So, the attachment style that we develop uh, can be also influenced strongly by the attachment style of our own caregivers, right? So, studies have already shown this concept or proven this concept of what we call the intergenerational transmission of attachment styles. So kung ano yung attachment style ng parent natin, yung caregiver natin, most likely yun yung magiging attachment style natin. So kapag secure yung attachment style ng caregiver, most likely secure din yung attachment style natin. Pag insecure, so sabi natin yung insecure, tatlong types yun: dismissive or avoidant, preoccupied or anxious, and then the fearful or disorganized. So pag ito yung mga attachment styles ng parents natin or caregivers natin, most likely yan din yung ating develop na attachment styles. All right. So nabanggit ko kanina that the attachment theory is based on empirical evidence, and there are neurobiological underpinnings to the secure attachment or insecure attachment. So dito nga at this slide is showing you so far ang mga lumabas sa research, no? So yung una, merong chemical sa brain natin, sa katawan natin, that's called oxytocin. And oxytocin apparently has anxiety relieving effect. So in other words, nakakakalma siya. And also it enhances our capacity to trust other people, no? So ano bang ibig sabihin nito? Categorically sabihin mo, pag mataas ang oxytocin mo, if we have enough of oxytocin, then our ability to regulate anxiety will be if sufficient and effective, and hindi mahirap magtiwala sa kapwa. Pag mababa ito, then most likely we will be very anxious and mahirap magtiwala. So probably become paranoid. Now, the second one is the high HPA axis. HPA stands for hypothalamic pituitary adrenal axis. So this axis or system in the body is a mixture of our endocrine system and the neurological nervous system. And the HPA axis is often triggered during stressful situations, fight, flight, or freeze responses. And secure attachment has been correlated with a adaptive hypoactivity of the HPA axis, meaning kapag we find ourselves in stressful situations, the HPA axis will tone down. It will become less active, right? So that it's not going to trigger the fight, flight, or freeze response. Okay, and then the third one, we have a neurotransmitter that's called dopamine. Maybe a lot of you are familiar with this, and dopamine is believed to be the neurotransmitter that makes us feel rewarded when we do something good. It also gives us that sense of well-being, right? So these are the uh, common and most researched neurobiological explanations to secure attachment. Okay, so let's now segue to mental illness or mental disorders. So attachment insecurity, if we have any of those three insecure attachments, then the chances of us developing mental health problems or mental disorders will be greater compared to a person who has a secure type of attachment, right? So how does this happen? If we have attachment figures who are inconsistent, they are unreliable, they are insensitive to our needs, this will lead to interference in our capacity to develop a secure and stable mental foundation or mental health foundation. This will also contribute to a disruption in our ability to develop our resilience when coping with stressful life events. And this reduction in resilience, the insecure, the lack of a secure and stable mental health foundation will then predispose an individual to break down psychologically whenever that individual finds himself or herself in times of crisis. So ano yung mga mental disorders na pwedeng ma-develop as a result of the insecure attachment style? So this is a list of so far yung mga naaral na. So in other words, these conditions are backed up by research evidence, no? But I think that in general, uh, all mental disorders or mental health problems are connected with insecure attachment styles. But so far, this is what these are the conditions that are backed up by research evidence. So you have personality disorders, schizophrenia, depressive disorders, anxiety disorders, obsessive compulsive disorder or OCD, post-traumatic stress disorder or PTSD, eating disorders, and suicidal behavior. Dr. Raymond mentioned about substance use disorders earlier. So yeah, there are studies also implicating insecure attachment style to the development of substance use disorders. Okay, now let me be clear and state that the construct of insecure attachment is not the sole predisposing factor to mental health problems or mental disorders. We must be cognizant of the fact that there are also other factors involved or at play in the development of mental health problems and disorders. So you have biological factors like genetic predisposition or the use of substances, other psychological factors like self-esteem issues, cognitive distortions, relationship problems, and adaptation strategies. Sociocultural factors like violence, discrimination, stigma, poverty also contribute to mental disorders or mental health problems, and spiritual factors like religious struggles and spiritual disconnection. Okay, now what are the mediators between insecure attachment and mental disorder? In other words, how do we get from having an insecure attachment to developing a mental health problem or disorder? So there are three mediators that have been found in research. You have self-representation problems, problems with emotional regulation, and problems in interpersonal relationships. So for the self-representations, what are these problems? You have the lack of self-cohesion, constant doubting about one's internal coherence and continuity over time. So in other words, just self-doubt in general. unstable self-esteem, overdependence on other people's approval, and pathological narcissism. For emotional regulation, so there are two paths here. So the first one would be cordoning off emotions from one's thoughts and actions. So that person presents a facade of security and composure. Parang wala lang, parang hindi siya affected, no? Because the emotions are cordoned off. Now, the problem with this is when the emotions are suppressed, then they are not going to be resolved. Kasi nga ito yung tinatawag na sinasabi na kinikimkim, no, or bottling up. So bottling up all those emotions will impair the ability of people to deal with life's adversities. On the other hand, we have amplification of anxiety, amplification of worries, exaggeration of anxieties, exaggeration of depressive reactions. It's as if wala nang pag-asa, the world is coming to an end, etc. PTSD intrusion symptoms also are amplified. Okay? And there are socially destructive outbursts of anger, impulsivity, and demandingness that towards relationship partners that can, in fact, lead to violence. And the third one, problems in interpersonal relationships. So for people with high avoidance, they don't want to, as much as possible, engage and connect. So they become cold, they become introverted, or they can be very competitive. Or those who have high anxious attachment, they have problems with emotionality, so they can become overly expressive, right? And this high avoidance and high anxious attachments can then lead to loneliness because of social isolation. It can lead to low relationship satisfaction, so happiness in the relationship, frequent relationship breakups, and frequent conflicts and violence. Okay, so I'm nearing the end of my talk now. So let's go back to the descriptions that I started off in this lecture. So yung first box dyan would refer to the avoidant type of attachment. And the second one, the one in the middle, refers to an anxious type of attachment style. And the box on your right would refer to secure attachment, right? So what do we do if we have insecure attachment, or our patients have insecure attachment, our clients have insecure attachment? The good news is there is neuroplasticity. Neuroplasticity meaning that the brain can change. When I was still in medical school, we were made to understand that when a brain cell dies, it dies it's forever gone. It can never be replaced. If a brain cell is damaged, it couldn't be repaired. Fortunately, we now have data, we have evidence that the brain can regenerate and it can repair itself. So in essence, if we have a brain that is operating on an insecure attachment style, we can do something to convert that insecure attachment style to a secure attachment. And these are some of the recommendations. So first, it's important to identify and acknowledge our type of attachment style, to understand that our attachment styles can change, to develop emotion regulation skills. We have a lot of techniques that could be utilized, like mindfulness, meditation, breathing exercises, etc. We share our feelings without blaming others. So using the I statements, so you refer to yourself instead of referring to the other person, and also sharing our feelings in manageable doses. It's important for us to surround ourselves with reliable and supportive people who could provide us with safety and stability and who can model and encourage healthy behaviors. We also can reparent ourselves, so reparenting that inner child within us by providing the nurturance and validation that we may have missed in childhood and acknowledging and healing the unmet needs of our younger selves. We need to understand and accept that change is gradual. So yes, change can happen, but it is gradual. So we have to have a lot of patience, and we need to realize that setbacks are normal. As I always tell my patients, in psychotherapy is about 1 step forward, 5 steps backward, 10 steps forward, 20 steps backward. So, the setbacks are expected and they're normal. Okay. So we must celebrate our progress no matter how small. And when all else fails, consult a mental health professional and seek psychotherapy. So with that, I end my presentation. Maraming salamat po. Thank you so much for your kind attention. This is my email address if you wish to get in touch with me. Thank you.
Alright, thank you so much. Sana po marami pong natutunan ng ating audience. Thank you, Dr. Delia. We'll go ahead and introduce our reactor po. I will call you back for our Q&A. But before we call in our reactor, we just want to greet those who are joining us all the way from Bicol Medical Center in Naga City, Camarines Sur. Those from University of Rizal Health System, if I'm not mistaken, from all the way from Davao City, from the Philippine General Hospital. Maraming salamat po from the province of Bataan, San Clemente Municipal Hall in Tarlac, Bataan General Hospital and Medical Center in Balanga, Bataan, the Dialysis Center by RTSI in Bacolod, Negros Occidental. Those watching us from Ilocos, from Oriental Mindoro Provincial Hospital in Calapan City, Oriental Mindoro, from Zamboanga. And you will also see internationally, we are also being viewed by our listeners and our followers po, no? All the way from Toronto, Canada, from University of Hail in Hail, Kingdom of Saudi Arabia, Island Hospital Penang in Pulau Penang, Malaysia, Mentari Intercultural School, Jakarta, in Daerah Khusus Ibu Kota, Jakarta, Indonesia, and Nam Cantao University Hospital in Cantao City, Vietnam. Thank you so much. And I think there's also a personal shout out for Dr. Delia that's also in the chat po. No? So maraming salamat po. Also like to introduce po our reactor at this point since we are a bit pressed for time. Our reactor po is the head of residency training, also from the same department, the Department of Psychiatry and Behavioral Medicine at the UP Philippine General Hospital. Please welcome to your screens, Dr. Michael P. Shonzon.
Okay. So good afternoon to everyone. Thank you very much, Dr. Delia, for that very comprehensive lecture. As always, it's a joy to learn from Dr. Delia. He was my teacher when I was residency training, and up to now I still continue to learn from him. No? So I'd like to make my reactions very brief, no, because we're pressed for time, and just emphasize, no, siguro the most central point that I got from Dr. Delia's lecture, which is that we are born with a predisposition to form attachment. So it's innate sa atin yon, likas sa atin. So this points to the importance of parenting, no, to ensure that we have strong attachments. However, no, we should resist the temptation to blame our parents whenever we have mental health issues. Usually kasi nangyayari, di ba? Parang meron nangyari sa problem if a person develops mental health issues, it's because of the parenting. Parenting plays an important role, but it's not the only factor. In fact, okay, as Dr. Delas pointed out, there's such a thing as intergenerational attachment, passing on of the attachment styles. So, for example, if a parent has insecure attachment because of his own childhood experience from parents who are not empathic, they will have difficulty forming secure attachments with their children. So, hindi nila kasalanan yon. It's really just you cannot give something that you don't have. Okay? However, even then, even if you have very empathic parents who have very secure attachments, they may still fail to give proper attachment opportunities for their children because of the demands of our times. Okay, so if you usually it's not uncommon for families to have both parents who are working. Dahil sa traffic sa Metro Manila, parents will have to leave early in the morning and they come home very late. So very limited na lang yung time for attachment, for bonding with their children. Okay. It's also not uncommon for families to have one parent or even both parents who are OFWs. So this again still limits the opportunities for children to form secure attachment. Okay. And since attachment, as Dr. De Las pointed, is very, very essential to our survival. So survival talaga siya. Okay. So when parents are not available, then the child will look for other sources of attachment. So dito napapasok yung influence. And hopefully it's good influence, but it can be negative influence from friends because of peer pressure. Okay. Now, we may say that at least social media. Social media can fill in that gap. No? Yung mga parents who are OFWs, at least they can still connect with their children. So social media, diba, improves our connectedness with each other wherever we are. But however, Dr. Delia also emphasized that attachment begins with physical attachment, physical connectedness. He also mentioned that oxytocin plays a very important role, in the development of the brain, and this is one of the neurotransmitters responsible for attachment. Now, oxytocin is only released because of the physical touch. It's triggered. Its release is triggered by the physical touch, and of course, social media will not be able to do that. Okay? So, kaya nga long distance relationships, it's very difficult. And if you look at it, ang daming factors involved. That's why to quit a common description when it comes to relationships, it's very complicated. Okay? So this is why it's very helpful that we have these kinds of opportunities for us to learn about the factors that can impact our mental health, and so that we can take positive actions to enhance it. So those are just my reactions. Thank you for this opportunity, Doctor. Thank you, Dr. Delia, for that very elucidating lecture.
Okay, thank you so much,
you.
Dr. Shonzon. We'll dive right in po to our Q&A. Maybe we can get like 2 or something questions po. No? Ma'am Stella, we'll go ahead with the first
Yeah,
question.
yes, I have a question. I had this patient who, as mentioned by Michael, ano siya, OFW. She was based in Saudi Arabia, and then the husband is in Kuwait. So magkahiwalay pa sila, and their child was taken care of by the sister of the patient. No, so ang laki ng ang laki talaga ng impact ng separation na yan, no? Because the children grew up na ang kanilang affinity doon sa aunt. Pag dumadating yung mom, parang hindi nila masyadong pinapansin yung mom. So, how do you get out of that situation? So, my question is for Dr. Delia. So, what can be done kaya in those very difficult situations?
Yeah. Thank you, Dr. Jose, for that question. Very interesting. It's a relevant and timely question because we have a lot of children who are whose parents are working abroad. So I think because of this particular situation, we have a lot of surrogate caregivers, surrogate parents. So whether they are yung yaya or relatives. So the attachment theory says that it doesn't really matter kung sino yung nagpo-provide nung caregiving for as long as the concepts of safe haven and secure base are provided. Of course, it's not to negate the limitation of parents being away kasi that's also relevant, but what may happen is if the child develops a strong bond with the caregiver, who let's say is the tita in that case, and then the parents come home and then the child does not respond to them in the way that they want, and then they have a negative reaction to that response, that can be damaging to the child, that the child sees these parents are acting in a strange way, in an anxious way, in a depressed way, in an angry way. The child will also pick that message up, and it can affect the sense of security. So the child will start thinking, maybe I did something wrong. Maybe am I such a bad child because my parents are reacting to me this way? And that those thoughts, those cognitive schemas can erode, the secure attachment, so to speak, that's being developed by the surrogate caregiver. So importante rin yung piliin natin yung surrogate caregiver natin. Kaya dito papasok yung importance of choosing our yayas. A lot of parents now are working nowadays, and because they're working, they rely on external help. Kung walang relatives, mga yayas. So we have to be very careful about the choice of caregivers for our children.
Thank you for your answer. Dr. Raymond, do you have a question?
Thank you, Ma'am Stella, and thank you also to the reaction from Dr. Shonzon. I think the question that I got, and just lang po, no, how can we support those individuals po, no, who may have, let's say, yung mga fearful avoidant po ng mga attachment styles. They may be reluctant or may have hesitation in building trust in those relationships. Kasi those things may have long-term implications po as they build their relationship. So what would be your recommendations po for Dr. Delia?
Yeah, thank you, Dr. Sarmiento. Gaya nga nung nasabi ko kanina, I think it begins with being aware. So self-awareness, I think, is very important, because it starts from there. Unless we are aware that there is a problem, that there is a situation, we have this kind of attachment style, then mahirap to change it. So I suggest that, because we have a lot of social media, reliable materials that people can utilize to increase their knowledge about about being self-aware to begin with, and once they have that awareness, then they move to seeking help from professionals, mental health professionals. Doesn't have to be a psychiatrist. Could be a guidance counselor. It could be a psychologist, a psychotherapist. So importante yung role nito ngayon ng mga schools, universities. They have to, the mental health law mandates every school, every university to come up with their own mental health programs, because they should be the ones that will provide the safe environment, the safe haven and the secure base. So if this is not being provided by the families, then at least in the schools we have that. So the students know that there is someone, or there is a place, a safe place and a safe person in school that I can, approach, talk to, and express my thoughts and feelings without feeling judged, or rejected or dismissed.
Yeah. If I may add, to that, to
Yeah.
Dr. Delia, parang I think these people who have, sabi nga I agree with Dr. Delia, it's really awareness. So when these people, when they come to us, usually for a depression, that's one of the things that we make the person aware. No? Na yung attachment style must avoid that. But secondly, more importantly, we have to build their capacity to form attachment. So dun papasok yung role of the therapist. But we shouldn't stop there. This is what I always tell my residents. No, we should help the patient learn how to form attachments outside of therapy. So yun yung mas mahalaga. Okay? Because they live in the real world, their contact with us is very limited. So we really have to help them learn how to build attachments. Kumbaga yun yung sabi ni Dr. Dela, kami, yung therapist, yung nagiging initial parent, but we shouldn't stop there. We should usher them to growth, to broaden and their horizons and build relationships.
Thank
Okay.
you very much for your answer, Mike. We appreciate your comments, and also from Dr. Tantedelia.
Okay po.
Raymond?
I think that in the interest of time lang po na, and we also have those questions that are seen in the Q&A, maybe we can ask our speakers po na if they have the time, maybe they can write up their responses to the questions po. I think we have like 5 at least, or 6 questions that we have in the Q&A. So at this point po, we'll ask the team to flash on the screen the evaluation poll. So in this evaluation poll is 5 statements, 4-point Likert scale. We will not be closing this until the end of the webinar. I'll read through it, and we encourage everyone to put in their answers and feedback. Number 1, the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists use appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. I think we have a technical issue. We just need to relaunch our evaluation poll kasi na-close po siya. So we'll just ask the webinar team to reopen it, relaunch it so that everyone can put in their answers as well. Thank you. Thank you so much to the team. Okay. So for next week, what will we have for next week, Ma'am Stella?
For next week, we have Dr. Ryan Capitolo, who will speak on pediatric gynecology.
Okay. Thank you so much, Ma'am Stella. So before we conclude our program, we'd like to thank the Department of Psychiatry and Behavioral Medicine, the UP College of Medicine, and the Philippine General Hospital, Dr. Constantine Delia and Dr. Michael Johnson. Maraming salamat po for sharing your insights. And also, we'd like to remind everyone, all health updates webinars are archived for viewing at the TVUP YouTube channel. Just go to www.youtube.com/TVUPPH, and you go to the live tab and you'll be able to see po all of the 218 after today, 219 webinars na po siya. Also, we understand everyone very busy. Meron din po in one of the tabs there at www.youtube.com/TVUPPH. Yung pong shorts tab po, nandun po siya. So if you can try and view them, you have some time po to view this 1 minute or less po ng mga videos. That will be very, very helpful as you hopefully gain nuggets of wisdom from this po. Okay, so this formally closes our webinar for this week. We look forward again to your company next Friday. Magkita po tayo ulit from 12 noon to 1 p.m. It's a day.
Together, we can stop preventable deaths.
So keep safe, keep healthy, and see you online.